Okay, hi. This is my first video. I am insomniac. Little take, as you could probably tell, on the word insomniac, which is something I've struggled with since I was, 3 years old. It began, and in my 30s now, pushing 40, still current. It is quite debilitating, well, very. But that's not what I'm here to talk about today. So I've been having some really I can't think of the word. That's another thing. Like vague symptoms that could possibly be like absolutely anything, because they really are just so vague, and I could probably do like 20 different diagnoses where they're that vague. So I went to my doctor. I've been back and forth to the doctors for maybe 8 to 10 years, complaining of fatigue, like exhausting fatigue. And I just have the usual blood test done, I'm always thirsty as well, drink a lot, wee a lot, so many symptoms, but I'll go through those in a minute. So obviously the first thing they always check for, and rightly so, is diabetes. That always comes back kind of clear. I think the highest mine's been is 38 on the HbA1c test. Although saying that, when I saw my endocrinologist the other day, she did say that's actually gone up to 40. So not sure there. Right, so anyway, my doctor referred me to the endocrinologist because one of my samples that I did, a urine sample, I did one of those 24-hour collection samples. It came back really super low sodium. So I think the sodium's meant to measure anywhere between, like, say 40 and 100 or something like that, or 40 and 80, 40 and 60, kind of high numbers. I think 40 and 100 though. Mine measured 20. So yeah, I mean, that's like lower than the lowest threshold they have for it, really. Nothing's been done about that yet. They did repeats, and that's still come back low, so low sodium. I initially recently went to my doctor's saying I thought I may have something along the lines of Addison's, actually, because I'd been Googling, as we all do. And yeah, Addison's kind of actually did fit the profile, but then saying that, so did diabetes, so did an underactive thyroid. I don't even know how you pronounce this one. This is stuff I've been writing down. Where is it? So one of them that I was looking at, I've no idea how you pronounce this, but it's spelled Sjogren's, Sjögren's syndrome or something. This is me looking into everything. And also POTS, because my blood pressure does change a lot upon standing and sitting. So I'm going to go through my list that I showed the endocrinologist of my day-to-day symptoms. Okay, so IBS-C, which is the constipation kind. It might be a little bit graphic. A constant bloating. It does not go away. I look possibly anywhere, depending upon the day, between 5 and 6.5 months pregnant. I have a lot of gas, as in like belching, but not the other end. I get stomach pain. My folate keeps dipping a lot, and a few times I've had to be put on folic acid tablets for that for a few months, and then like a year later I get a test and it's very low again. So I don't know if there's something in that. Insomnia, fatigue, lack of motivation, lack of energy, constant insatiable thirst, frequent urination, basically every half hour or so, lightheadedness, especially upon standing, low blood pressure, short-term memory problems, struggling to concentrate, struggling to learn new things, forgetting words, fluttering in my chest, right side abdominal pain, cramping, feels similar to ovulation but happens about 10 times in a row every so often, so that's obviously not ovulation, but it's in the right place for that, I guess. Feeling dehydrated all the time, no matter how much I drink. Now, I drink, you're going to tell me off, I'm going to get so much hate for it. I drink between 3.6 litres and 4.2 litres a day. I do try to keep it to 3.4, 3.6 litres, but that is me trying so hard, and I feel dehydrated drinking that little, because to me, the way I feel, I should be drinking perhaps a litre or two more than that, but obviously I know that that's dangerous, so I have to kind of pace myself with that. Nausea, low appetite, as in like I get full quickly. I don't get hungry, I crave the taste of food, but I do get full very quickly. I get hot and cold quickly, like my temperature just won't regulate itself or keep itself regulated. I have itchy skin, mostly my shins or my back, which gets worse particularly at night. Brittle nails that flake all the time. I haven't had a period actually in, oh god, nearly 17 years. I put that down to, God, I've gone brain dead. Periods. I put that down to being put on the, what's it called? The thing in the arm, the contraceptive implant. Because I went on that, but then I also went on, it's quite heavy medication, like some antipsychotics and stuff like that, around about the same time, and then my periods just stopped, and I haven't had one since, so I don't know if that is a symptom of me, whatever's wrong with me, or if it is the tablets, or if it is the, for God's sake, this happens so often. The contraceptive implant, yeah, that's the one. Okay, back to the symptoms, almost finished. So I have darkened pigmentation on some scars, and like my top lip, don't know if you can see it, but it's like the edges are like darker on my top lip, but not on my bottom, so I don't know if that's classed as hyperpigmentation. And I've also got a little bit, hold on a scar. Oh, it's night time, so you probably won't be able to see it. I've got it on a scar on, oh, I can see it, yeah, on my arm, just there. So that's the hyperpigmentation. Where are we down to? We're getting there. I feel run down all the time, like either I've got the beginnings of a cold, or flu-y. It just feels that way all the time. I get like stuffy in the back of my nose as well, and I have a post-nasal drip. Medication doesn't really seem to help with that. I do catch illnesses quite quickly, and I take longer to recover than my family. My wounds do take longer to heal. At times I have upper back pain, knee pain. Recently, I'd say the last 2 months or so, I'm having like carpal tunnel syndrome like pains. I haven't been diagnosed with it, but from reading, that's exactly what it sounds like, in my hands, arms, fingers. I bruise easily, sometimes without being injured at all. I have a very distended abdomen, as we've already, like, with the bloating, kind of goes hand in hand maybe, and clumsiness. There's one particular wall in my house that I will always whack my shoulder into as I'm going past. It's like, I know it's there, but I don't know if it's a sight thing, a coordination thing, or what, but my shoulder whacks that wall. If it's not my shoulder, it's my arm. So annoying. Right, so that's the main stuff. Bit of background information. I do have bipolar disorder, type 1. I was diagnosed with that in my 20s. I also have PTSD. Do you know, I can't think. Like, this happens so often. It's like it's just on the edge of your tongue, but your brain just can't think of what it's called. So I have like a lot of like, I call them brain foggy moments. Whether they are or not, I don't actually know. Oh, that's a new symptom I've had, probably for about a month, is, as you could probably see, like, bit of acne. Like, I'm not wearing any makeup except a little bit of mascara, but so yeah, I've been having like spots and stuff. They're actually like quite bad on my back and tops of my shoulders. That's been a new thing. So I'm basically doing this video to kind of document my health, really, I suppose, like, until I get a diagnosis, and then maybe about recovery or whatever. I'm hoping, well, they have found something when I saw endocrinology, because at my first endocrinology appointment I went through that whole list, and she did say that because I do have bipolar disorder, it could basically just be psychiatric or psychosomatic, and that is one thing I absolutely hate to hear. It's like a pet hate of mine. It's like, because you've been diagnosed with a mental health disorder, they always try to put everything on your mental health. I'm fatigued, I'm tired. Yeah, it's probably your bipolar or your bipolar meds, you know. And that they insomnia again, you know, could be this. Well, no, it's not. I've had it since I was 3. So, like, that's my insomnia. We'll talk about that a little bit. How that started was, yeah, I was about 3 years old. Absolutely happy. Nothing, like, dodgy or whatever. And I just started waking at, like, 3 o'clock in the morning. Every night. And I couldn't get back to sleep. Like, I'd just be wide awake, ready, raring to go, 3 a.m. That went on for years. When I was about 8, 9, I was medicated for it, because I think it was like driving my mum a little bit mad, me being up so early in the mornings. I mean, that can't have been good for her, although I did used to just creep downstairs and watch a bit of telly. Yeah, so I was put on medication for that then, amitriptyline, I think it was. So that was like a antidepressant, because I was suffering from depression back then, with like a sleeping thing in it. And boy, did they knock me out. They did, because also I was given slightly higher dose, like, at first, like, to help it work quicker. So yeah, and then when I reached about 15, I think, I then started having trouble falling asleep. So it would take me 2-3 hours to fall asleep. And then I'd wake up at 3 o'clock in the morning. So that was difficult. And then I reached 30. And then when I reached 30, it was struggling to fall asleep. Take it 3-4 hours, unless I have a Zopiclone. Then I fall asleep faster, but I don't stay asleep. Either way, if I take a Zopiclone or if I don't, I will wake several times during the night, probably 3-4 times during the night I will be up. And then now it's actually 2 o'clock in the morning that is my wake up time. I feel exhausted all day. I do try to nap. Sometimes I can. Mostly I can't. I've tried I've tried taking naps where I can, and obviously that doesn't work. I've tried stopping the napping in the hope that I'll sleep longer at night. That doesn't do anything either. So really am at a lost cause with that, but I keep going off track, and I'm sorry for that. So my endocrinology appointment that I had last week, So she said, looking at my bloods and the urine back, there is actually something physically wrong, which sounds weird, but I'm pleased about, because if they could find a physical cause, then that means that there'll be treatment, and they may be able to give me something to make me feel, I'm not saying 100% better, because that probably won't happen, but at least begin to feel a little bit more human and be able to stay awake longer than 3 hours in the day, without having to, try to sleep or rest my eyes for so many hours. Like, I just feel it's like a wave of exhaustion. It just hits me several times a day, and I've tried testing my blood sugar. Sometimes it's a little on the low side when I'm like that, but most of the time it isn't. It's just regular. It's like a 5 or something. So salt, strangely enough, this is why I thought Addison's, because if I had a little bit of salt, that could actually pep me up and wake me up a little bit more. Whereas the times I have sugar, I've been falling asleep almost immediately after having it, like a bit of chocolate or something. Well, I say a bit of chocolate, a whole chocolate bar actually. Yeah, so I have the whole chocolate bar, and then I literally half an hour later I actually do fall asleep. But that's not good for me, like too much chocolate. So back to endocrinology again. I'm so sorry. So the appointment, so she said yes, there is something wrong. I haven't actually discussed, other than with my partner, exactly what they found. Well, not what they found, but what they're leaning towards. All I'll say is she said to me, what was that? What she found with my bloods, there was something rare there. So something she doesn't see an awful lot of. So she wanted a repeat bloods done, and she also said that she can't pinpoint one diagnosis at the moment. It's sort of like she's looking at, that there's several things she's contemplating at the moment that it could be. I mean, she did mention, though, weirdly, something about the growth hormone was elevated or something. So, and then she asked me if I had any relatives, that were really, really tall, which I don't. She did ask me if my hands or my feet had grown. And the weird thing about that is, maybe about 5-6 years ago, I was buying shoes, and I'd always been a size sort of like 4 to 5, 5.5 maximum. And like now, and like 2015, I was going up to sort of 6, 6.5. These are UK sizes, don't worry. But yeah, UK sizes. So that was a little bit weird that she mentioned that, because my feet had grown, I'd say, yeah, in length a little bit, but actually more in width, because I've been having to buy sort of like wider fitting, not necessarily, 2-3 XL wide foot or whatever, or E or F or anything that crazy, but wider fitting normal shoes, should we say. So yeah, and my brain's on it again, I'm so sorry. Shoes, wide feet. Oh, and hands. Yep, she was asking if my hands had grown or got bigger or anything. Now, they have actually got across, if I could do it, this bit here, oh my god, I can't do it, and I'm holding the camera. So widthways, again, they have got a bit wider, probably by one whole size, I'd guess, like by gloves, because I used to wear a small and now I'm in a medium. So she said she wanted a repeat of those bloods done, which was the growth factor hormone she wants back. And then she said if it's still elevated, then she will arrange a scan. She is looking at sort of like something wrong, possibly with the pituitary glands. So, and obviously I googled that, and That's a whole bunch of scary stuff, like tumours and all that kind of stuff like that. But from what I've read about it, it's pretty simple to treat. Like, not saying it's easy, no one that's gone through it says that it's easy at all, but it is treatable, and like 100% treatable if they can remove the whole tumour. But I'm hoping it isn't a tumour, because the idea of surgery I don't like. And another thing I was kind of considering, because she did say, I don't know if she made a mistake when she said this, because she said your I thought she was going to say that my sodium was low, but she said oh, your potassium's still quite high. And there's me thinking, didn't know my potassium was high. And she went, and your sodium is still very low. And so again, tap tap tap, Dr. Google, Addison's came up again. So whether or not I do have that, we'll figure out soon. But yeah, I just made this video just in case anybody else is sort of maybe waiting for their first endocrinology appointment, or they too are having quite vague symptoms and don't know what to make of it. Definitely don't do what I did and just go like once a year to the doctor. Like, definitely chase it up, which is what I've done this time round, and things are moving. Yeah, definitely don't sit there, because you'll be in my position and it'll probably be, whatever it is, more difficult to treat because it's been years upon years of something being wrong. Yeah, if like me as well, you've got mental health problems, don't let the doctors sort of pigeonhole you into that and put all your symptoms down to it. Just say no, just spite to be looked at properly. So this video is actually longer than I wanted it to be. I will keep you guys posted. I will let you know when I have my test results or anything like that. I'll upload another video, or if I'm feeling a little vulnerable or fancy a chat, or I'm kind of doing this as a vlog to help people, but also sort of help me too. So yeah, if I felt like just getting something off my chest or discussing it, yeah, I'll be here. If any one of you have been through something similar, know someone who's been through something similar, sort of what were you or they diagnosed with? I mean, how are they feeling now? Has it been long since it was discovered, and how are they feeling? How's the treatment plan? Do they feel any better at all, or is it almost as though it just wasn't worth getting diagnosed because you don't feel any different, just a name for it? That would be interesting to know. Or even if you just want to say hi, you know, just drop a comment down there and say hi, and I'll say hi back. So I am going to leave you guys now, because I'm just like blabbering and I don't know what to say. Okay, well, thank you for listening. If you do want to know how my health ends up panning out, then hit the like button and the follow button, if there is a follow button. Sorry, I'm not all that familiar with like YouTube, but oh, hit the bell icon. That bit I do remember from my partner watching loads of YouTube videos. I always hear that bit. Subscribe, hit that notification bell. Yeah, and if I say anything else, I'm going to be copying somebody else, so I'm not going to. Thanks, and I'll be tuning in soon. Oh, and I've got a blood test on Monday. Might do a little video after, see how I feel. Take care, guys, and thank you. Bye.